Today we'll be learning about Master Patient Index. You may have heard of Master Patient Index, or an MPI. But what is an MPI? To explain, let's use an example. This is Sarah. Sarah is pregnant. During the course of Sarah's pregnancy, she's going to interact with a lot of different applications used by her providers in the health system. She's going to need to go to antenatal care clinics, HIV and PMTCT clinics, and even immunization clinics. Each one of these functions are what we call healthcare verticals. These are typically broken along disease vectors or care paths. Each vertical typically has its own staff, its own software applications, and its own clinical data, which these software applications track. This data is then used to derive indicators and inform outcomes for that particular program vertical. Problem is, each vertical has its own series of software, data, and outcomes, and these are typically different from other verticals. So, if Sarah visits an antenatal care clinic, she might be given some sort of identifier for that particular program vertical. And later on, when she visits an HIV clinic, she is most likely going to get another ID for that particular vertical. But imagine if we want to share Sarah's data, say for a report, between these healthcare verticals. From an integration perspective, the system receiving the aggregated data would have to ask the question, is this one patient or is it two? To solve this, we need a consistent way of identifying Sarah across systems. A national identifier is one such way we can accomplish this. If we gave Sarah a national health identifier, we could cross-reference her between systems. But how do we cross-reference these health identifiers with local program identifiers? The answer is a Master Patient Index. So, let's say Sarah shows up for an antenatal care visit. Her physician would use their own software to enter Sarah's information. Inside the antenatal care software, it would still give Sarah a local antenatal care identifier. However, that software would now send her demographic information to a master patient index like the MedicCR. Here, the MedicCR would generate a unique identifier for Sarah and share it back with the antenatal care system for future reference. It would also link Sarah's local identifier with this newly generated unique identifier for Sarah. Sarah could be given a card with this identifier to use in a future visit. Later on, when Sarah visits an HIV clinic, her physician would use that system to enter her visit information as they normally would. This time, her clinician would also include the unique identifier previously given to Sarah. Again, the clinician is using their own software, and it generates a local identifier for Sarah for that particular program vertical. The system would then send that information again to the Master Patient Index. Here, it would cross-reference Sarah to an existing Master Patient Index record. The MPI would then simply associate the new local ID for HIV care with the master record and share the status of Sarah's MPI record back to that local program vertical software. Now we have an MPI with one record for Sarah. That MPI record cross-references all of Sarah's local program identifiers with this master record. Using the MPI in this manner, we create a patient-centered digital health ecosystem rather than a disease-centric ecosystem. Using the Master Patient Index, we can reliably identify Sarah and her baby and make sure that they are cared for no matter where they seek care. For more information about the MPI or the MedicCR, visit our website at www.mohawkmedic.org.